Good morning, Mr. Blake. What brings you in today?
Good morning, doctor. I've got really bad nasal congestion. My nose is so stuffed up that I can hardly stand it.
That's no good. How long have you had the congestion?
My nose has been stuffed up for over a week now.
Okay. Have you used anything to help with the congestion?
I used an over-the-counter nasal spray. It's a decongestant spray. That's what the label said. Now it feels like my nose is even more blocked.
Okay. And how long did you use the spray for?
I've been using it a few times a day for the past week. It helped for a little while, but now the congestion is back again.
Right. It sounds like you might be experiencing something called rebound congestion.
Rebound congestion? What's that exactly?
Rebound congestion is something that happens when nasal decongestant sprays are used for longer than the recommended time. They shouldn't be used for longer than 5 days. When first used, the nasal spray works by constricting the blood vessels in your nasal passages, which helps to open up your airways. But if you use the spray for too long, the blood vessels become sensitized to the active ingredients in the nasal spray and the medication stops working as it should.
I see.
Your blood vessels expect to constrict, but the moment the medication wears off, the blood vessels start to swell up again. In some cases, the inflammation is even worse than before.
Yes. That's exactly what's happened.
Then, using the spray becomes a cycle. As the nasal stuffiness gets worse, people think they should use the spray more frequently to feel better, but this makes the situation worse.
I had no idea. Does this happen with all nasal sprays?
Not all nasal sprays, only sprays containing active ingredients called oxymetazoline or phenylephrine. These types of nasal sprays can cause rebound congestion, or something called tachyphylaxis. That's a type of dependency where the nasal spray becomes less effective over time.
So it stops working even if I use more of it.
That's right. Your nasal tissue becomes less responsive to the medication. This is why most decongestants should only be used between 1 and 4 times a day, and never for more than 5 days in a row.
Well, I still need something to help with the nasal congestion. It's so uncomfortable, especially at night when I'm trying to get to sleep. Is there anything else available for long-term use?
Yes, there is. Steroid nasal sprays that contain fluticasone, for example, can help to reduce inflammation and congestion without causing any rebound effects. They don't give you the same instant relief that decongestant nasal sprays give, but they are much better for chronic congestion.
What about taking decongestant medication? As a tablet, I mean.
That's an option too. Oral decongestant medication doesn't usually cause rebound congestion because the medication doesn't act directly on the nasal tissues. The only issue is that they can raise blood pressure and heart rate, so doctors are cautious about recommending them, especially in people with hypertension.
Okay.
There are also some simple remedies like saline nasal sprays or steam inhalation that you may find soothing.
Right.
What I want you to do now is to stop the decongestant spray gradually. I'll prescribe a steroid spray for you to use in the meantime, until your nasal passages heal. I recommend using a saline spray as well, to help with the congestion.
How should I taper off my use of the nasal decongestant spray?
As I said, you'll need to do it gradually. For the next week, just use the spray at night, and in one nostril only. Use the saline spray as well, to keep your nasal tissues moist. You may get a headache as well as congestion at first, but this can usually be managed with an over-the-counter pain medication.
Okay. I'll do that.